Pillows and positional therapy as immediate remedy for acid reflux. When we eat, the contents of our stomach normally proceed into the intestines with the aid of the digestive muscle contractions. However, those who have acid reflux disease, the digestive contents travel back into the esophagus. And since the digestive material contains acid, a patient suffers from inflammation in the throat, which may be associated with pains in the abdominal or breastbone. Other symptoms include dyspepsia, vomiting, regurgitation, and respiratory-related indicators. Acid reflux is a chronic health condition. Once it has started transmitting into the body, it continues to inhabit indefinitely. Although the treatments are available, symptoms usually tend to be applied repeatedly. And this means that treatments also need to be employed recurrently. The act of stomach liquid backing up into the esophagus is actually quite normal. It also happens to those without the acid reflux disease. In the case of acid reflux patients, however, the stomach contents have more acid than normal, and that acid tends to stay in the esophagus for a long period of time. The human body, of course, has its own mechanisms to lessen the harmful effects brought about by the reflux acids. An example of such is the salivary glands found in the mouth. These glands produce saliva, a liquid which contains bicarbonate. When we swallow, the saliva containing the bicarbonate passes through the esophagus. Bicarbonates have the ability to neutralize acids, which may have remained in the earlier regurgitation. Also, studies have shown that most cases of reflux happen during daytime. At this time, individuals are usually upright in the upright position. With the aid of gravity, reflux is minimalized because the stomach contents are held back down. Moreover, when awake, individuals recurrently swallow. This practice maximizes the benefits of the saliva does in reducing the levels of acid in the throat. The mentioned natural ways of the body to protect itself are important in the maintenance of the esophagus, but only saliva, swallowing, and gravity can work when a person is in an upright position. During the nighttime, when individuals cannot sleep, gravity cannot help so much. Also, saliva secretion is trimmed down, and swallowing does not take place. It is for these reasons why acid reflux, which comes about at night, becomes more severe sore in the esophagus because the acids stay longer and therefore do more damage. Acid reflux can be more susceptible to pregnant and obese. The increased levels of hormones during pregnancy and high levels of fat in the body can increase acid reflux because of the pressure in the lower esophageal sphincter, a muscle that prevents the stomach contents from moving back into the esophagus, is reduced. As such, it will be easier for the partially digested contents to come back because of less force holding them back down. In addition, for pregnant women, the pressure on the abdominal rises due to the development of the fetus in the womb. There are ways to help the body minimize the occurrence of reflux. One of the easiest is to implement position therapy. This is done by elevating the head and torso when in a sleeping position. Pillows, which are readily available, can be positioned to raise the torso about 6 to 8 inches. This provides maximum effectiveness in holding back reflux. Surveys have shown that the use of this increased recommended elevation results in greater efficiency.